75% of heart attack victims had LDL under 130. Half of the heart attack victims had LDL under 100. Hello, and welcome to this very important breather show on the topic of testing and tracking for your heart disease risk. I don't mean to do this complex and highly scientific subject a disservice by breezing through some quick tips, but I think it's important to acquaint you with some of this information in hopes that you will dig further and get tested and listen to great experts on podcasts and books. Dr. Peter Attia is getting a lot of attention with his #1 best-selling book, Outlive, where he talks about heart disease risk as well as cancer risk and Alzheimer dementia risk in detail. But I want to just get this on your radar and provide you with a quick overview of the progressive thinking that's happening these days as we extricate ourselves from decades-old dogma that is now being shown to be incomplete and flawed and dated conjecture. So we thought for a long time that this so-called lipid hypothesis of heart disease was the gospel, and that is the commentary that consuming saturated fat and cholesterol in the diet will increase your heart disease risk. So we want to stay away from eggs and other sources of fat and cholesterol. And we now know from great studies like the Framingham Heart Study, the longest and largest epidemiological study in the history, that is the study of lifestyle behaviors on disease risk factors. It's from residents of Framingham, Massachusetts. It's ongoing. It's the source of thousands of papers, started in 1948, and some strong conclusions from the study director that we quote in the Primal Blueprint. Dietary fat intake and dietary cholesterol intake has no correlation with heart disease risk. Especially dietary cholesterol, if you reduce dietary cholesterol, your body will simply make more. And so now the evolved thinking about heart disease is that it is caused by oxidation and inflammation. These are two circumstances that occur in the body from adverse lifestyle habits, all manner of them, including overly stressful patterns, poor diet, overly stressful exercise patterns, all kinds of unhealthy lifestyle that show up in this catch-all term called metabolic syndrome. And this is a term used to describe an assortment of heart disease risk factors widely attributed to today's unhealthy lifestyle habits. The Cleveland Clinic, highly respected, says, quote, "The exact cause of metabolic syndrome is not known, but many features are associated with insulin resistance." A lot of times we combine heart disease risk with this poor metabolic health of producing too much insulin, being in the state of hyperinsulinemia. So these are the 5 markers that are associated with metabolic syndrome. So if you have 3 or more, you are officially labeled with this prevailing modern disease pattern of metabolic syndrome. And it's not a good deal. You want to correct these as soon as possible. The interesting thing is that 4 out of the 5 can be corrected within weeks of dietary modification and throwing in some exercise and other healthy lifestyle practices like getting better sleep. The 5th one that takes a while is the waistline. So you're going to lose inches off your waistline over time. But listen to these 5, and we want to know where we stand with these metabolic disease risk factors. Number 1 is an elevated fasting blood glucose of 100 or greater. And now we have the power to use the continuous glucose monitor to get even more information, because a lot of times that snapshot, that glucose value that you deliver on your annual physical may be an unnecessary cause for alarm, or it might have been a good value, but not really indicative of the fact that you are coming into metabolic disease patterns. So fasting blood glucose, a high blood pressure that's over 130/85, that's in excess of 130/85, is a marker for metabolic syndrome. A waistline measurement of 40 inches or more for men, 35 or more for women. More accurately, Dr. Ron Sinha, who's been a podcast guest, host of the Meta Health podcast, wants you to measure your height and then your waistline, and you want to be under double waistline to height. So if your waistline's 35, you want to be at least 5'10". If you're under 5'10" and your waistline's 35, as mentioned here for women, or with men 40, so that would be That would be 6'8". So I think it's a better, more accurate tracker to check waistline less than double your height. HDL, this is marker number 4. And low HDL is a marker for metabolic syndrome. So 40 or less for men, less than 40 for men, less than 50 for women. If you have suboptimal levels of HDL, you leave your body vulnerable to oxidation and inflammation. HDL is often called the good cholesterol because it scavenges the bloodstream for damaged molecules that are potentially going to contribute to the heart disease process when the small dense LDL particles that lodge on the walls of your arteries and begin the heart disease process and the oxidation and inflammation of those particles. And then finally, 5th on the list of metabolic syndrome markers are triglycerides of 150 or greater. And Dr. Sinha doesn't like that generosity there. He wants to see your triglycerides at 100 or below. There's around 47 million Americans, 1 in 5, that meet these criteria to be diagnosed with metabolic syndrome. And again, you can correct this in a few weeks of dietary and lifestyle modification. Now, the go-to blood values that today's leading experts like Dr. Sinha, Dr. Kate Shanahan, Dr. Paul Saladino are conveying, the best way to track for heart disease risk is your triglycerides to HDL ratio. And you want to strive for an ideal value of 1-to-1 or better. So remember I said you want those triglycerides under 100. And you also want your HDL up over 60 to be optimal HDL status. And if you can get those closer together, like getting your triglycerides down to 65 and your HDL at 65, 1-to-1 or better. My latest blood test, my HDL is 65 or something, and my triglycerides were in the 20s. So I'm well better than the 1-to-1 ideal, and it's urgent to get 3.5-to-1 or better to get out of that red flag disease risk zone. So think about your triglycerides at 150 and your HDL down at 30. You're outside of that urgent requirement. So we want to take care of that immediately. Also, very important, Paul Saladino says this is his most important blood value, is your fasting insulin level. And amazingly, shockingly so, it will not be performed on a routine screening and your annual physical. You have to ask and sometimes beg and argue to add fasting insulin, even though it's a very inexpensive test of 20 or 30 bucks if you pay for it yourself. You want to see that fasting insulin number. The values quoted to get below 15 is urgent. If you are over 15, you're in hyperinsulinemia, which we learned from the Cleveland Clinic is directly associated with metabolic syndrome. So below 15 is urgent, below 5 is optimal, and below 3 is outstanding. So insist on your fasting insulin test. Even if your blood glucose looks good and they say everything looks fine here, we want to know more. Dr. Peter Attia now talks about this test for ApoB. That's a new favored test, and this will help you understand whether this high LDL value that often comes up red on the blood test, that's the old, flawed, and dated thinking where we oversimplified the heart disease process to track LDL, and the doctors still call HDL good cholesterol, which is correct and accurate, and they say your bad cholesterol was 138, and that's too high, we're going to give you statins. This is 40 to 50 to 60 years dated using flawed and dated research that has now been overturned by many of the most respected leading experts, including Framingham study and much more. So the ApoB test will tell you if this high LDL number is a problem or if it's benign. And it will also, your triglyceride to HDL ratio will also tell you whether you're in good shape and you just might have a higher LDL value because you're carrying around a lot of large, fluffy LDL, which are generally harmless, as opposed to the potentially problematic small, dense LDL particles. So the ApoB is another test if you're going to look further, especially if you've had some adverse values or you're meeting the metabolic syndrome markers. Now you want to go test your butt off and see what you can learn and see how lifestyle modification can turn these things around. There are also some inflammatory markers that are highly favored to track your state of systemic inflammation, which many medical experts agree represents the root cause of virtually all disease. So if you have high inflammatory markers in the body, you are setting the potential for the heart disease process to take place in your arteries because of your generally inflammatory state. And hyperinsulinemia, chronically high insulin production, is definitely a sign that you are suffering from systemic inflammation. Also, HSCRP is a blood test that stands for high sensitivity CRP, or C-reactive protein. So you might hear it called C-reactive protein or CRP. You want to get that number in the healthy level, which is a point or 1 or 2 or 3. But if it's at 23 or 38, that's probably an indication that you're in an acute infection. And if it's up there at 10 or 15 or 20, it's a sign that some sort of inflammation, some adverse chronic inflammation is going on in your body. And again, if you're concerned, go get yourself a continuous glucose monitor and go on the journey with NutriSense. NutriSense.io/Brad will give you a discount and give you some benefits with one-on-one consultation with a trained dietitian. So you slap the thing on your arm and you go for a 2-week journey where you're getting 24/7 blood glucose values and noticing how certain lifestyle behaviors affect your glucose management. So it's way more information than just getting your blood test once a year, or even if you're testing with a glucose meter a few times a day. This is all the time, and your responsiveness to exercise and your food choices and all that. HbA1c, hemoglobin A1c, is what they call on the blood test estimated average glucose. So they're trying to see what your glucose values have been over about a 6-week period. So it's a guess of your overall glucose levels in the bloodstream. That's important to get that value up in the favorable category, which I believe is 5.5 or below. A lot of people are drifting up to 6 or 6.1. And again, these are early indicators of metabolic syndrome and vastly increased heart disease risk. I told you that the storyline of lower your LDL through the use of statins is 40 years dated research. And Dr. Sinha cites a meta-study performed by UCLA. A meta-study is a study of hundreds of study conclusions. So these conclusions are highly respected because they're taking, maybe there were some crappy studies out there that people are trumping and saying the vegan diet trumps all other diets, but this is a meta-study. And so the meta-study showed that 75% of heart attack victims had normal LDL levels, many of them artificially suppressed through statins. So 75% of heart attack victims had LDL under 130. Half of the heart attack victims had LDL under 100. So these people went to their physicians, they got a clean bill of health and a thumbs up because their LDL looks great, and then they went and had a heart attack because they were suffering from oxidation and inflammation, as evidenced by those metabolic syndrome markers that I listed. So if you have any concerns at all, I want you to go deep, get the proper blood tests, look at a bigger picture, take the NutriSense journey because it'll be wonderful for behavior modification if you are making some adverse lifestyle choices like skimping on sleep now and then, or going and getting indulgent desserts that are processed and jacking up your blood sugar. It's graphic information right there in your face to help get you to do things like say no to crappy food, or get up from the dinner table and take a walk around the block and see how good that is for glucose management. And finally, I'll close the show with another advanced test that's difficult to get, but if you are in the concern category, you want to get a coronary artery calcium scan and receive a calcium scan score. And amazingly, I called all around town. One place told me that they would do it for me, and I went in, paid money, and they didn't do the test. They didn't even know what the test was. They did a different test. And I finally performed a coronary artery calcium scan score. And this is the calcification that is built up in your arteries over a lifetime. Of course, I'm not a high-risk person for heart disease. However, my history as an extreme training endurance athlete, we have seen in many long-time endurance athletes calcification in the arteries due to overuse or really pushing the cardiovascular system to the maximum. So I wanted to go in there and get a calcium scan score. So if you have concerns like a long history of extreme endurance exercise, I highly recommend going in and getting a calcium scan. If you have an unfavorable number, the goal for the rest of your life is to not increase that number. So whatever you've done to this point, listening to the show and going in and getting your test, you can't reverse that calcification of your arteries. You just want to keep it managed by engaging in healthy lifestyle practices. For example, not extremely overdoing your endurance training, your pursuits, and stressing the heart accordingly. Okay, so that is the latest and greatest of testing and tracking for heart disease risk. Hopefully this will inspire you to listen to further programming, or at least go out there and get tested and track your basic numbers. Thanks for listening, watching.